So she hurt her Achilles tendon. So right now I'm just kind of feeling both of them just to see what they feel like. You know, the left one is clearly more swollen than the right one is. I'm going to have you sit this way, put your feet this way actually. So what I'm going to check right now is I just want to check her ankle range of motion, see if it's restricted. So I'm going to bring both of them up. And you can clearly see that this one's not nearly as high as the other one. And obviously she's wincing, so it's painful too. Does it hurt at all on the outside too? Or just mostly on the inside?
Well, it hurts when you touch it. So
Or on the outside too when you touch it?
A little bit, yeah. Pushing there, yeah.
Now, does it hurt all the way up here too?
Not just to the touch. If I go deep in there, I can feel that it's...
Up in here, right?
Yeah, not quite, yeah. I don't...
And if I press on the bottom of your foot?
No,
nothing?
not yet.
So when it comes to the Achilles, you have the two muscles, the gastrocnemius and the soleus. They start up here. The gastrocs, the superficial one.
Well, my dad is wondering how much.
It's I filmed you today, so we're good for today.
Thank you.
You're welcome.
Thank you very much.
Yep. So, anyway, so the gastrocs is the superficial one, soleus is the deep one. They come together, they form the Achilles tendon. So that's why I was checking to see if there's any tenderness up here. And then it attaches to the heel, but then you have muscles that go from your feet that come and wrap around and they attach to your heel. So they're all interconnected. So I wanted to see if by me pressing on the bottom of her foot was also maybe causing some irritation of her Achilles, but it's not.
Yet, no. I've had it before where my Achilles just felt like it really needed to be stretched, and then it wrapped around to my heel, and then I did realize that working in here took care of it, but...
and lots of times you can work on stuff up here that refer pain down to here, but because you're so swollen down here, it's obviously clearly an Achilles issue. So another thing we want to do is, this is her good ankle, so we want to see what kind of ulnar and, not ulnar, looking for a deviation of the ankle.
What she could do?
For both sides to see if the joint is locked up at all. And this one does work a little bit more freely. That one hurts just doing that.
Well, it hurts you, yes.
Because I'm squeezing that
Yeah.
right there. But it's not really that bad. So now I'm going to go like this and rotate it around. So the first thing I'm going to do with treatment before I do any muscle work is I'm going to mobilize her calcaneus, which is the heel bone right here. And the way you do that is you press on it like this, and you rotate it around like that. And I'm going to try to keep my fingers off the inside where it was hurting her Achilles, because I just want to loosen up that heel bone. I feel okay?
Yeah.
And then I'm going to kind of slowly distract the calcaneus. And you should feel a little bit of a gapping a little bit right there. Okay, not too much, but just a little bit. Just making sure everything's nice and loose like here. Okay, so now I'm going to grab up here also and just kind of loosen up the talus part. Because you can already feel that's gapping already, so that doesn't need to be moved too much. And now I'm going to do this one. Just pulling like this. Do me a favor, grab the table a little bit. So I'm going to distract it and I'm going to pull. Okay, so now what I'm going to have her do is lay on her stomach, and we're going to work out her calf muscle. Go ahead and lay on your stomach.
Oh.
Okay. So I'm going to start up here, and I can feel that the tension starts right in there on both sides. So what I'm actually going to do, if it's not too uncomfortable for her, is have her lay a little bit on this hip for me actually. I'm going to bring this thing up. There you go. And I'm going to come through, because I'm going to come through inside. Because if its tightness is down this low, I'm thinking more soleus. If your tightness was more up here over the knee, I'm thinking more gastrocnemius. Since it's deeper down here, you can clearly feel it's tight and tender right there. That's more of a soleus. So I'm going to work, and the best way to get to the soleus, because it's deep to the gastroc, is to work on this inside area right here. So we're going to work from here all the way down and into the tender area. So we're going to start up here. What you're going to feel is pain at first, for like 30 seconds or so. You should feel the muscle kind of relax and release. Are you covering the screen at all?
No.
Okay. How are you doing?
Fine.
Not too bad there?
Nope.
So bring my head down. Right there, give me a little bit more. Tender right there.
Can we stop? Where do you want me to stop?
So what we're going to do is we're going to loosen up the whole area, and then I'm going to put some compression bands on it later to see if we can get some increased blood flow and flush the ankle out. So I'm basically going to start here and work all the way down to her heel.
I'm trying
Yeah.
to relax, but I'm having a hard time.
Fine. So we started up on the calf, and now we're way down by her heel, and we're working on the actual Achilles part. And so I'm really working the attachment where it attaches to the heel, basically. And so now it's not muscle anymore, and it's now turned into tendon. And tendon's a little bit more harder to break up because it's stiff and it's not pliable like muscle is. But I could feel it kind of loosening up.
Yeah.
Like, see this one? This is like wrinkler than that one.
So now I'm going to come to the top a little bit more, and then go a little bit more on this side. Except the pain's more on the inside, it seems like. Okay. So we're just going to loosen up this Achilles, and then we're going to do a compression band on it.
Good.
Okay, so now we're literally going to take this Achilles tendon like this, and we're going to take it, and we're just going to move it back and forth. And we're basically just kind of mobilizing the Achilles. Get it nice and loosened up. We don't want it to be sticking to any layers below it. And we want to make sure it's nice and flexible. So we're going to move it, and we're going to even move it right up next to where it attaches to the heel too. And just really kind of loosen it up. How's that feel?
It's a little painful, but
Okay. Okay. And before, when we first started this, I wouldn't be able to grab her Achilles like this, but since we've kind of loosened it up, she's able to tolerate me actually squeezing it now and loosening it up. So now I'm really able to get that thing to move back and forth. And now we're doing some figure eights right here. Now we're just going to stretch out a little bit. Stop it for a second. Go ahead and lay on your back now.
I'm asking you.
Ready.
Are you ready?
I guess.
Ready.
Okay, so what we're going to do is we're going to take this compression band. You can see if you want. And because the Achilles has such limited blood flow, I'm going to bring this thing over, and we're going to literally wrap it around the Achilles. What we're going to do is I'm going to grab here, and I'm really going to stretch it, and then bring it over.
Yeah.
And she'll feel a lot of pressure right there.
But the good news, my toenail polish matches the band.
Yes, it does.
So
So
we
once
got
again,
that going.
you go like this.
Mm.
So I'm basically pinning it, and then I'm stretching it, and then I'm bringing it over. Yeah. So now what we're going to do is bring our foot, and that way I can come to the other side now. So once again, actually it's the same side, huh? Pulling it, coming around, pulling it, coming around.
Just lay down here.
Yeah, this is not the most funnest thing you can do. It's really painful. But it really addresses the pain that's on the Achilles.
Oh my goodness.
Okay, so now what I'm gonna have her do is get her foot straight.
Oh.
You're gonna bring her foot up by yourself. Bring it up as high as you can, and then drop it down as far as you can.
I can't really move it.
Yeah, you just do as much as you can. Not a big deal. Up and down, up and down, up and down. Okay, now you're gonna rotate your foot this way.
Oh.
Rotate as much as you possibly can. Okay, now rotate the other way.
I don't think I'm doing any of it.
I think she's rotating her right foot more than she is her left right now. So we're gonna keep rotating it.
Oh my goodness.
I thought that was
up and down again. Up and down. Down. Okay, now I'm gonna quickly loosen this thing up. And what you should feel is blood flow kind of coming to the bottom of his Achilles. And we're just going to mobilize that Achilles just to help get more blood flow. We're going to do this probably 3 times. That's okay with you.
Okay.
But this time when we do it, first of all, let's see what we're going with his feet now. Let's see if you can see now that the left one, if you come to the side, Peyton, come over here. Over here, Peyton. If you shoot this way, you can see now that this leg actually goes higher than the other one. When we first started, it was more like this, and now we got this foot up higher. So you can tell that we definitely loosen things up. You can feel like the relief, and like you can feel like the blood flow going through there.
Yes.
So the whole idea is trying to flush out.
Oh my gosh.
But you can see all the marks from the dead band, so you can tell it was really, really tight. Obviously the mark's going to go away in just a little bit. The whole idea is just to nice and circulate that Achilles, bring blood flow in there, because it was all swollen, so what we're hoping to do is flush out all that stuff that was caught in the Achilles. And the best thing to do for Achilles is also do some eccentric type heel drops, and we'll show you how to do those in a second. So go ahead and walk around and feel how you feel. You can turn it off and I'm going to show her.